So the occlusion workshop is really about adding on to what the participants learn in facially generated treatment planning. So we take a deeper look at the exam, the comprehensive exam, or some of the components of the comprehensive exam. And then what's really exciting is we really learn to apply it.
We learn to do a more detailed examination, and then we tie together the things that we see to a set of mounted casts. In other words, let's take what we can observe, let's go to a three-dimensional representation of the patient and find out, does that make sense? Can we tie that back? And then if there are changes we'd like to make, what happens when we make those changes to the teeth? Now, not the real teeth, but the teeth on stone models. That lets us see what will happen as we do that. We also spend time with appliance therapy. So we have an opportunity to make an anterior bite plane with each other, which is kind of the simplest appliance that I would tend to apply for home wear. We talk about the other appliances, the rationale, when to apply a specific appliance, how to develop a plan for time and outcome with appliances, how to feel comfortable going home, that you have some idea how the function is relating to what you're seeing, and how to make a plan forward for that patient that would work for that patient functionally.
The occlusion workshop helps the dentist be better really because it gives them really a lot more confidence and competence because they're actually doing things so that when they go back home, it's not just something that was philosophical. They go back home and they've actually experienced a lot of it. It's given them something that they can do right when they go back home so they can implement it. They play the assistant role in a couple different things that we do in the occlusion workshop, so they get to experience it as a patient, as a dentist, and an assistant. So totally, they go back and they can really speak to their team a little different from if they were to just not have that experience. When they leave occlusion, I think what they love most is the confidence what they learned here actually works, because we test it while they're here, so they can see how accurate, like say for instance, the bite records are. And when they go back, they know when they're taking bite records that they know they work. And so it's this confidence that what they learned works in everyday practice.